All right, I'm going to be doing my medical administration. So, first thing I'm going to do is check my provider's orders with my MAR. So I've got the physician's order right here. So I'm going to double check the MAR and the physician's order, make sure that there's no discrepancies. Got my tuberculin TB skin test, right dose, cyanocobalamin, right dose, right medicine, my insulin Lispro, right dose, my milk of magnesia, right dose, right route. These are all right doses, they're all right routes. And my topical ointment, my mupirocin 2%, is also on here, right arm, right arm. So I've double checked my physician's orders with the medicine, right dose, right time, right amount, and of course, right patient. I've got my patient's name and birth date, so the physician's order and the MAR match up. I put my physician's order away. Okay, so my medications, I'm going to run through them real quick. I've got my tuberculin up first. It's a PPD. Its action is it aids in the diagnosis of TB. And let's see, what I'm going to be considering here is hypersensitivity or reactions after administration. Next, we've got our cyanocobalamin. It's a vitamin B12 shot. Basically, my considerations with that are going to be the patient's GI tract. I'm going to assess him for constipation or diarrhea because the vitamin B12 could affect those. My next medicine is going to be the insulin Lispro. It's obvious anti-diabetic. What I'm going to be looking for there is probably an A1C test before administration. And then after administration, I'll be checking for hyperglycemia. Next is the milk of magnesia. It's a laxative. Milk of magnesia is a laxative, and what I'm going to be looking for there is checking the patient for his cause of constipation, because I don't want the milk of magnesia to interfere with anything he's already taken. And also I'll be checking him for cramping, rectal bleeding, or assess whether he's nauseated or perhaps vomiting. Last is the mupirocin, the 2% ointment. It's a topical ointment, and basically what I'm looking for there is I'm going to be taking into consideration any allergic reactions or hypersensitivity the patient may have, and I'm going to want to keep it away from any mucous membrane. So, all right, now that I've checked my medicines, I'm going to do my first check. So I'm going to open my cart. All right, got my cart, got my patient's med box. I'm going to take my keys with me. All right, so what I'm doing here on my first check is I'm going to be checking the 6 rights of medication, the right patient, the right medicine, the right dose, the right route, the right time, and at the end I'll be doing the right documentation. So first up is my tuberculin, and I got my tuberculin PPD. I'm checking the bottle. The date is good. It has not been opened. It's brand new. Everything appears correct, and it is the correct medicine that the MAR states. Second is the cyanocobalamin. The bottle is good. The date is good. Everything seems in order. It is the right medicine that the MAR states. Next is going to be my insulin Lispro. It's the right medicine. It's brand new bottle, hasn't been opened. The date's good, and this is the same medicine that's on the MAR, so it is good. Next is the milk of magnesia, a laxative. The bottle is good. The date is good. I'm checking it with the MAR. It's the correct medicine, so it checks out on the MAR. And last is my topical ointment, my mupirocin 2%. It's a brand new tube, the date's good, no defects, and it's the same medicine that's on the MAR. So my medicines are good for my first check. So now I'm going to perform my second check now. With my second check, I'm going to just be running through there again and doing any math calculations that I need to do. So first up, the milk of magnesia. Once again, the bottle's good, the date's good, checks out on the MAR. No math to do there, just 30 milliliters in the oral cup. The mupirocin 2%, same deal, no math. I'm just going to be applying a light layer of ointment, and the mupirocin checks out for the patient. That's correct. Next is the cyanocobalamin. It's my vitamin B12 shot. The bottle checks out. It's good. The date's good. Now I'm going to be administering 1,000 micrograms intramuscularly, and there is 1,000 micrograms per milliliter. So I will be administering 1 milliliter of the vitamin B12 cyanocobalamin. So there's my math, 1 milliliter on that. Next is the TB shot. The PPD, I'm only administering 0.1 milliliters. Once again, I'm checking the bottle. It's good, date's good, bottle's good, a brand new product, and 1 milliliter. So no math to do there. And last is the insulin. Now the insulin is going to be 6 units. I have an insulin syringe, so I can just draw up the correct amount of units, no math to do. The bottle is good, the date's good, brand new bottle of insulin. Insulin is a high alert medicine, so that after I perform my calculations and get the medicine ready, I will have it checked by another nurse. All right, now I've done my 2 checks. I'm going to do my 3rd check. I'm going to be getting my, I'm going to be preparing my medicines. I'm going to do some hand hygiene, get my hands clean. I'm going to go ahead and get the oral ready. I'm going to put the label in palm. Once again, the bottle has been checked. It's good. And I'm going to pour 30 milliliters out.
That's going to go subcutaneously. And then we're also going to be giving
This bottle did not have 30 milliliters in it.
which comes 2,000 milligrams per 20 ml or 100 milligrams per ml.
Go ahead, fill it up.
And we're going to be giving
Just fill it up.
50 milligrams, so that's going to be at 0.5 ml. And that's going to go IM. And I'm going to be putting my IM in the Venturus Loralis. And I'm going to be putting my heparin, ZQ, and
Always something. Okay, the bottle did not have 30 milliliters in it, but I would be holding the label in the palm. I'd be pouring the medicine at eye level to 30 milliliters. I'd be measuring it at the meniscus of the fluid, not the edges. And I'll turn that so you can see it if you can't. It should be at the 30 milliliter mark. So that medicine has been prepared. Okay. Next is going to be the ointment, the mupirocin. Once again, I'm going to check it. It's the right medicine, matches the MAR. I'm going to be taking the whole tube in there. So, okay. Next is going to be the TB. I'm going to get my TB syringe ready. Now, what I'm going to do is get the TB medicine, the PPD. I'm going to be checking it one last time, a 3rd time, so it is the correct medicine. It's brand new, the date's good, the medicine is good. So I'm going to clean the vial. Make sure that it's clean. Let it air dry. I'm going to get my syringe ready. my tuberculin syringe, intradermal syringe. I'm gonna draw up the air. I'm going to insert. If my needle was to become contaminated at any point, I'd have to throw the whole syringe away. So I'm going to discard the syringe because I touched the edge of the vial. The syringe would go into the sharps, it would be gone. I would get a new tuberculin syringe. I would clean the vial again to make sure that it's clean. I would let it air dry. Now, I have a new tuberculin syringe, it is uncontaminated. I'm going to draw my air. I'm going to put the air into the vial without touching the hub onto the vial.
5x to 3x. And I'm going to be drawing up 2.5 mLs of heparin. I have 1,000 milliliters or 1,000 units per 1 ml, so that's 2.5 mLs.
0.1 milliliters.
Invert.
I'm going to cap it with the one-handed scoop method. Going to check for air bubbles.
Scoop. Which one?
Air bubbles out. And if you come in close, you can see that I have 0.1 milliliters of PPD. I'm going to label that medicine.
I'm going to clean my bottle again so that I can draw up some DeJarnette. And I have 2,000 milligrams per 20 mLs, and it's 100 milligrams per 1 ml. And I'm only given 50 milligrams.
Okay, so
0.5 mLs.
okay, next is I'm going to be preparing my insulin. So same deal with the insulin. I'm going to check the medicine. I'm going to make sure the date's good, the bottle's good. I'm going to make sure that it matches the MAR. It's good. I'm going to get my insulin syringe.
No air. 0.5.
Chasing the cap there.
mLs.
I'm going to get my insulin syringe. Again, if the needle was to become contaminated at all, I would get rid of it. This is a clean syringe. And I am going to be getting it ready. I would clean the vial, let it air dry. I would draw up my 6 units of air.
Before I administer any of these medications. So I have
Not touching the hub.
this is my DeJarnette, which is
I would draw the 6 units out.
50 milligrams. My heparin.
My cap is rolled away. I'm going to do the one-handed scoop method.
Okay.
All right, checking for air bubbles.
So I have on my medications. I have 1 PO, 3 injections, and 1 topical.
And
I'm going to lock my med cart. And take all my stuff over here to the bedside to prepare to administer my meds to my patients. So I'm gonna get my MAR and take that with me.
we got 1 air bubble. I'm just trying to get it out.
And I'm going to put all this in here.
There it goes.
Not
So
before
the air bubble is out. And you come in close, you can see the 6 units. Insulin is a high alert, and so I would have it checked. by another nurse. I'm going to, I'd have it checked, but by another nurse before I administer it to the patient.
I'm going to sanitize my hands. I'm going to identify my patient. I'm also going to, get a washcloth so I can clean her room for her properly.
Alright, the last medication I'm going to prepare
That I
is
have
my
the right-
vitamin B12 shot, the cyanocobalamin, 1,000 micrograms.
the right dosage.
Same deal, I'm going to double check with the MAR, check the date, check the bottle. The bottle's good, it's the correct medicine, and I would double check it with the MAR, make sure that it's good. So the cyanocobalamin is good. I'm going to be administering 1 milliliter.
Left arm for her whip to apply her top.
I'm going to draw in the air.
I'm just gonna be cleaning the wound today. I just need
I'm going to clean the vial and let it air dry.
11/9/81.
I'm going to check the air.
Ms. Jones, do you have any allergies or anything before we get started today? Your, patient record says you have no allergies. Is that correct? Okay, so we can go ahead and get started. I'm gonna, raise her up just a little bit so she can take the video lens as well. Right, so
Not touching the hub.
left arm.
Pull it out. One-handed scoop. Check for air bubbles. I do have one. It's gone now. And if you will come in, you can see that I have 1 milliliter prepared. I'm going to label this.
Alright, so I have my vaccination. This is my left wing. Left arm. Alright, so this is
Now that I have all that my medicines are prepared, I'm going to be ready to go to the patient's room. As I said, I would have my high alerts like my insulin checked by another nurse. I'm going to clean up the med cart, putting my medicines back. The medicines are secure, got the cart locked, I have the key. Okay, so I have my medicines and my MAR, and I am going to go to the patient's room. Now, before I go to the patient's room, I'm going to go ahead and empty the water out of these so that I can finish the project.
My third injection is going to be around 30 which is the video 50 milligrams.
If my needle or syringe was become contaminated, I would change it out for a clean needle and syringe. as stated, I would not use an infected syringe or needle. But now that my medicines are empty of the water, I'm going to go into the patient's room. I'm going to be taking my MAR with me. Okay. Get to the patient's room. I will knock and enter. Introduce myself. Hi, I'm Morgan. I'm going to be your nurse today. The first thing I'm going to do is verify my patient by asking in their name and birthday. Miss Jones, she gives me a birthday, 11/9/81. I verify with her armband, and I verify with the MAR to assure that I have the right patient. So, what I'm going to tell Miss Jones is that I'm going to be administering some medications today. Before we get started, do you have any known allergies to medicines, to TB derivatives, to ointments, latex, any insulins? The patient has no known allergies, so it's safe to proceed. I'm going to assess the patient, make sure that they feel okay. They do, so the patient is okay. I'm going to pull the privacy curtain. I'm going to perform hand hygiene. And I'm going to raise the bed to a proper working height. I'm going to position the patient setting up because the first thing I'm going to administer is the oral dose. So the hand hygiene, I'm going to put some gloves on.
Did you watch the video? Your video is 31 minutes.
Inform the patient that they're going to be taking an oral dose of milk with magnesia. I'm going to double check again with the MAR. It is the correct medicine, it is the correct dose. So once again, I'm checking for right patient, right dose, right patient, right med, right dose, right route, and right time. I've double checked all of that. Milk and magnesia is good. Let the patient take it. Patient does okay, has no adverse effects, they're okay. Next is the topical ointment, the mupirocin 2%. Patient has a wound on their right arm. To administer this, I'm going to first clean the area with a rag. Clean the skin, make sure that the skin is there's nothing on it. Going to apply the ointment to my finger. I'm going to lightly apply the ointment to have an even coat over the wounded area. So the ointment has been administered. I'm going to put that down. I'm going to change my gloves. I'm going to perform hand hygiene. I'm going to get 2 more gloves out. And I'm going to be ready to do my injection. Now, my first injection is going to be the TB intradermal injection. So we're using the forearm area. So the first thing I'm going to do is clean the area. So I'm going to locate the area on the forearm. This area here. Going to clean the area, circular motion in, moving out. Area is still wet with alcohol. I'm going to pull the skin taut. I'm going to hold my needle, my syringe bevel up. I'm going to insert at a 5 to 15 degree angle. Bevel up, I'm going to use a darting motion, and I'm only going to go in about 1/8 of an inch. Quickly, I'm going to slowly and evenly displace the medicine. What I'm looking for is the appearance of a wheal or a bleb, and when I get that, I'm going to pull out quickly, gently dab the area with some gauze, and put my sharp immediately into the sharp container. Okay. Now I'm going to inform the patient that this test will have to be double checked. I'm sorry, this test will have to be examined within 48 to 72 hours, and if they have been discharged at that time, they'll have to come back to get that done. So, my next injection will be my insulin injection. I will be doing that on the posterior arm. So, I'll again be cleaning it. So, I will locate the position of the arm. I'll have a hand deltoid. I'll have a hand above the elbow. I'll make a diamond shape. And what I'm looking for is the fatty area on the posterior arm. I'm going to be cleaning it, circular motion. Area is still wet from the alcohol. Going to hold the syringe level up. I'm going to pinch the subcutaneous tissue, and I'm going to insert at a 45-degree angle, quickly in a darting motion. I'm going to slowly inject the insulin evenly. The syringe was a little sticky, but I would administer the medicine slowly and evenly, and then I would quickly pull out, hold gauze on it, and throw the sharps away. Okay, after administering that, my last injection will be the IM injection on the vastus lateralis. I'll have the patient turn on their side. I will again locate the area. I will be putting a hand on the below the groin, a hand above the knee. I'll put my thumbs together, and the area I'm looking for is right there where my thumbs meet in the muscly part of the leg. I'm going to clean in circular motion. Going to prepare my needle. I'm going to insert at a 90-degree angle. Quickly. Apply evenly and slowly. Pull out and hold a gauze on. Sharps go immediately into the sharp container. And I will apply pressure just to make sure there's no bleeding, or I could put Band-Aids on these. So now that all the medicine has been administered, I will assess the patient for adverse effects. They are having none, and I will make sure they feel okay. They feel okay. I will inform the patient that I will be back to check on them within 30 minutes to assess how they're feeling or if there are any hypersensitivity issues. I will get rid of my gloves and perform hand hygiene. I will lower the bed to a safe height. I will make sure the patient is comfortable. The patient's comfortable setting up, so I'm going to leave the patient setting up. I'm going to make sure they have their call light, their water, make sure that they have everything they need. And then I'm going to get my supplies that I brought in. I'm going to be pulling the privacy curtain back open so that the patient is the way they were when I came in. They're comfortable, their curtain's drawn, and I'll thank them and tell them to have a nice day. When I leave, I will be documenting all the medicines that I gave. I will be specifically documenting the time and the route so that the next shift or that the other nurses know not to re-administer any medicine. But I would appropriately document my medication administration and move on to the next patient.